Dr. Harida. Good evening, good afternoon, and good morning. This is the 1516th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. STINE RUGE from Denmark. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, homeopathic doctors, and students, and we have 3 sessions every day, from 7:30 to 8:30, the Hindi session, which is already over today, and 8:30 to 9:30, we have the international session in English, and 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself, so that you can subscribe it without paying a penny, and you can share it with your friends. Those who want to watch it again and again can watch and subscribe the same to your friends also. You can ask your friends to subscribe the same also. The purpose of the International Forum for Promoting Homeopathy is to make homeopathy to verse every home all over the world, and not only that, to show the world that homeopathy can do this much of things with our medicines, and the homeopathy is the latest and purest science in the world. Today, let me introduce the guest of the day, Dr. STINE RUGE. She's from Denmark officially, but she belongs to, she is now practicing at UK, and she is a homeopathic specialist in obstetrics and gynecology and midwifery. And today the subject of discussion is hyperemesis and its management. She had taken a session last some 2 months back, and the session was really excellent. So we can proudly welcome Dr. STINE RUGE to this session. Welcome, Doctor.
Thank you very much. And lovely to be following a woman today. I know there are not many in here. So let me just share my screen.
Yeah.
Here we go.
Yes.
Everyone can see.
Yes, yes, we can see. Everything is fine. You can go ahead with your presentation.
Good. All right. So, as Dr. Danish already said, my name is Stine Ruge, and I'm trained from Center for Homeopathic Education in London, but I am actually currently living in Copenhagen in Denmark, from where I practice. I specialize in homeopathic obstetrics and midwifery, and today we're going to talk about hyperemesis gravidarum, which just very shortly explained, hyper, something is over functioning, emesis, something about vomiting, and gravidarum, which is pregnancy. And that's actually very similar to the Danish word for pregnancy. So let's take a look. So we all know morning sickness, and most of us who has ever met a pregnant woman will also be aware of this. So hyperemesis is very much like morning sickness. It's just very, very much more. So morning sickness is nausea, vomiting, feeling unwell, especially during the first trimester, but without interrupting daily activities too much. So you might have to take a day off, you might have to take a few days off, a few weeks perhaps, but it has to, it has to become better. And usually the symptoms does decrease within the first 12 weeks. But hyperemesis, on the other hand, is where all these symptoms are so bad that you're not able to continue your daily activities. You're not able to go to work, take care of your children, whatever you do in daily life. Sometimes, in many of the hyperemesis cases, actually, hospitalization is needed because the nausea and or the vomiting is so severe that it leads to dehydration, electrolyte disturbance, which can be very risky for the heart, nutritional deficiency, which really says a lot about how our fetus will develop and how we will get along in our pregnancy, because a lot of nutrients are taken from our body to the baby also during childbirth and breastfeeding. Weight loss, which is not supposed to happen when we're pregnant, extreme exhaustion, and usually there is a complete lack of appetite. And as you can probably hear, there are a lot of risks here, and the women who has to be hospitalized, they go to the hospital to be able to get fluids and food, because that's the only way that can happen. But there isn't really a cure for it. In the hospital, the woman will usually get some anti-nausea medication, but we don't really know what to do with these women. We also need to be aware that women suffering from hyperemesis are in higher risk of developing liver and kidney disorders like diabetes, hypertension, hypotension, edema, jaundice, intrahepatic cholestasis, which is the pregnancy itch, and preeclampsia. So these are disorders that we usually see in women who already before pregnancy had some kind of imbalances in her organs or in her digestive systems. It could be chronic inflammation, and a lot of these things you can probably tell from your own practices. We see more or less in a lot of people here today in the modern world. So looking at the etiology and epidemiology of hyperemesis, what we find is that it's more common in twin pregnancy, which lead us to think, that's maybe because we produce more hormones. There is a thing about female fetuses. That's also something about hormones with a girl being carried by a woman, young age. And this is actually not defined, like how young is young age? Is it a hormonal thing? How young is she? Is it a mental emotional thing acting on her well-being? Lower socioeconomic status? And that can very well also be a mental emotional factor here, like how do we finance this? How do we get a place to live? Or how can we afford to feed another child? But we know from the lower social class that it is a big problem to get good nutrition. And if this woman has not been able to have good quality nutrition, healthy, clean drinking water throughout her life or in the last few years, we know that she's in a worse place. She's in a higher risk of something developing during pregnancy. And maybe it hasn't started with her. Maybe she, as a fetus, was in a uterus of a woman who was also in this situation where she didn't get good enough nutrition or even just enough. So that can very well be a factor. Genetic factors, including other family members who has had it. And if we look at epigenetics, and we know now that we can do something, we can change about 95% of our epigenetics, but we still have to be aware of it to change it. So the issue is that we usually inherit the way our parents eat, the way they live, how they handle stress, how they handle emotions, and that is why there is a genetic factor. Hormonal imbalances, including GDF15, which I will talk more about in a bit. But all kinds of hormonal imbalances, if the woman has a history of PCOS or endometriosis, stuff like that, we know she's in a higher risk. History of hormonal treatment. So this could be the pill, all kind of hormonal hormonal drugs, excuse me. But it could also be fertility treatment. And I very often see this in my clinic, also because more and more women these days needs hormonal treatment in order to become pregnant. Low weight and or obesity before pregnancy. So that's again something about nutrition. You can be underweight or you can be overweight and still have a lack of nutrition. Gallbladder imbalance, liver imbalance, thyroid imbalance, insulin and blood sugar imbalance. So what this all tells us is that there is something about metabolism and nutrition. There is something about hormones, and there is something about the organs involved in the digestion. So we actually know quite a lot of the etiology from just looking at who is in greater risk of developing hyperemesis. And if we look into the homeopathic repertories, this is just 2 rubrics, but we can already see here only by looking at the remedies. If we didn't know anything about hyperemesis, if we didn't research it, but only looked at the rubrics, we can already, just by looking at the remedies, get a chance to figure out that this might have something to do with the liver. There are a lot of liver remedies here. So what does it do to the baby? And this is obviously not something we want to hear when we are pregnant, suffering from hyperemesis, but we have to look at it as practitioners. And the obvious thing is lower birth weight. That is why a lot of women with hyperemesis get checked more regularly than the women who are not suffering from anything, because we also have to keep in mind that there are these risks of developing all these different disorders, preeclampsia, and so on. Neurodevelopment delay, which can have a big factor in how our child will develop, but also feel around birth, and vitamin K deficiency. And of all the women you will meet, I am definitely not someone who will promote the vitamin K shot during birth. I feel like it is being used too much and very unnecessary in most of the cases. But this is actually a very good reason to use it in cases where the mother hasn't been having enough nutritions. Hyperemesis in utero is associated with increased risk of adverse child outcome, including abnormal brain growth, neurodevelopmental delay, autism spectrum disorders, ADHD, childhood cancer, and respiratory disorders. So what can we use this information for? Well, when we have these cases, and I assume a lot of us do have a lot of cases with children in the autism spectrum or hyperactive children, we can look at how the mother was feeling while she was pregnant. And if we see symptoms of possible hyperemesis, we can then, alongside with constitutional treatment, or what our way into this child's treatment plan is, we can, alongside with that, give supporting remedies to support the colon, the liver, and make sure the nutrition balance is optimal. And why is it good to know that the entire history of the pregnancy, including a very high level of GDF15, is stored in the placenta? Well, because the remedy made from the child's own placenta plays a huge role in these cases. So if possible, we want to have a remedy made from the woman's placenta, the woman that we have been treating through pregnancy due to hyperemesis. We tell her to keep a piece of the placenta stored in alcohol, and then we get a homeopathic pharmacy to potentize it for us. I usually work with placenta remedies in 40C, and they are amazing for treating both the mother and the child for everything that has happened out of balance during pregnancy, during childbirth, and it's a remedy which can give us a lot in the cases of difficulty of bonding between mother and baby, life changes, development issues, and all these are present. All these are present here. So I would definitely, I would definitely have a remedy made from a piece of the placenta if possible in these cases. So let's look at the GDF15. So this time in life, this time in the world is a very, very good time to dig into hyperemesis because it does get a lot of attention in the allopathic world right now. The thing is that last year, a huge allopathic breakthrough happened when scientists released a study linking GDF15 imbalance with hyperemesis. And GDF15 is a stress-induced hormone acting on the brainstem. It is located in our blood and released by the liver. We still have a lot more to discover about this hormone, but we know that it decreases appetite, which is common in so many of my hyperemesis cases. I can't think of one case I've treated where the woman actually had a good appetite. It causes nausea and vomiting during pregnancy, short NVP, and it has been measured to be higher, this hormone, in women suffering from hyperemesis, especially those hospitalized. It's still not clear how this finding can be used to cure hyperemesis. You know, we have to be very careful of allopathic medication we give to women during pregnancy because we don't know if it can harm more than cure. But it does mean that women suffering with hyperemesis is now being taken more seriously. It's not just morning sickness. So even though the allopathic world still isn't sure how to cure this, it has meant so much for a lot of women all around the world. We don't know for sure how many women suffering from hyperemesis. Some says less than 2% of pregnant women. Some says that's about 3 million women all across the world. And all of these women has in common that they are not being taken seriously when they go to the doctor. So this finding of the GDF15 hormone makes a huge difference for those women, even though there is still no cure, but it means it's a thing. It's not just morning sickness. But how can we, as homeopaths, use this information? Well, so far we know by looking at the mechanism of GDF15 that it is released by cortisol and adrenaline. So there is a stress thing going on. We also know that hyperemesis is more common where inflammation, digestive and hormonal imbalances are found. We have solutions for all of that as homeopaths. It is a matter of holistic and individualized case analysis. Furthermore, it is known that exercise, fatty acids, and I would say always go for the food solution if possible. It would be great if it could be before pregnancy. Get good fatty acids from dairy, from fish, from meat, high quality grass-fed meat, good sources of fat like avocados and seeds and nuts. And it's also seen that amino acids like lysine can be helpful to stimulate GDF15 in a good way. So as homeopaths, we always want to feed the system something where the body can be stimulated to work for itself in just giving anti-nausea remedies. But I think that, you know, the whole breakthrough about GDF15, like it's apparently a huge finding and it's great, but we need to look at the obvious. We need to look at how is this released and what makes it out of balance and who are these women who suffer from hyperemesis, because that is how we know how to treat it. So back to the, is it all just in my head? We could call it the female curse. Historically, there has always been a lack of interest among doctors and scientists regarding female disorders. It has been poorly researched and most often classified as it is all in your head. Excuse me. Perhaps we haven't questioned it because we've gotten so used to hearing women in pain being physically and psychologically referred to as she's just being hormonal, don't give her too much attention. And I'm not born 200 years ago. I'm not even born 50 years ago. And I have still grown up with this. But we only have to go back to the 1950s to see that the causation of hyperemesis was believed to be shameful from the visualization, the growing belly, of an active sex life. And for many years, hyperemesis was also excused by the "it's all in your head." But what if a part of the etiology is found in the head, in the mental emotional state? Well, that doesn't make female disorders less of a disorder. In fact, that only makes it a human disorder, and that is why homeopathic and holistic treatment in general are so effective, especially with all the knowledge we have about our own impact on the epigenetics alongside with miasmatic treatment. So the mental emotional etiology, which must be viewed with the same level of passion as the GDF-15 currently is, includes questions, feelings, thoughts about what kind of mother will I be? Will I be good at it? How will it change our marriage? How will it change our life? Have I chosen the right father for my children? And will he be able to manage that role? So this might seem to be worries that is normal, and they could be to a certain degree. But we also know that if existential worries or any kind of fear in general takes over too much, then it does start affecting our organs. It does affect our happiness, our appetite on life. We only have to look to Chinese medicine, who tells us everything we need to know about how different emotions are stored in different organs, and how it drains the organs from energy and makes them work less good. It could also be thoughts and emotions about financial, cultural, internal, and external worries. So external worries could be where we're going to live, how we're going to pay for another child in school, all of these things. The fear of admitting the reality. So when we look at how the emotions and the physical body are impacting each other, the thing about not wanting to face the reality, maybe we want to, keep the fact that we are pregnant out in an arm length. Perhaps we want to keep it a secret because we got pregnant without being married, or we got pregnant at the time where we are not supposed to, job-wise or educational-wise, and it makes it very, very hard to digest emotionally. Then we we kind of keep it out in an arm's length, and we know from looking at how emotions affect our organs that that is the direct way to nausea. So we make a cut between the brain and the gut, and that leads us to nausea. It could also be a fear of miscarriage. Perhaps we have a history of miscarriage. Maybe we don't want to bond with our child because we are too afraid that it will make a possible miscarriage worse. So we kind of deny that we are pregnant in order to take care of ourselves and prevent being too sad if we miscarriage. That's the same, leads to nausea. It could be ancestral trauma. So we carry our ancestral history in our genes. We carry our mother's story. We carry our grandmother's stories, and all the women before them. We were made as an egg in the uterus, or in our grandmother's uterus while she was pregnant with our mother. We carry a lot of their history, and that could also be a factor for why there is a mental emotional etiology for our hyperemesis. So mother wounds and generational mother wounds. Mother wounds is when we have a complicated relationship with our mother. Maybe she had a complicated relationship with her mother, and so on and so on. Which makes it difficult for us to imagine becoming mothers, because we're in this kind of limbo, and healing the mother wound meditations, healing the mother wound focus are a big thing for many women during pregnancy. And we as homeopaths can help the woman just by listening to her when we are in consultations. The decision to welcome a child is a life-changing decision. Everything is meant to change. And that's it, really. We can't make a decision as big as this and expect everything to be normal. And obviously that will trigger something inside of us. So if we need to summarize the physical and mental emotional etiology, which is understanding the etiology is the key to successful treatment. So we know that the etiology of hyperemesis is found in the hormones, in the digestive organs, in chronic inflammation, in nutritional deficiency, and in our psychological well-being, including stress level. The physical state and the emotional state impacts each other, how emotions and organs communicate. So when we know all this, it will already be easier for us to prescribe, even cure these cases. And the statistics says that women who experience hyperemesis will experience it again, 95% sure. But can we as homeopaths or holistic practitioners make a difference to the future pregnancies of the patients? Yes, we can, by looking at all these factors of the etiology. We can do a lot for the chronic inflammation. It's all about the insulin level, isn't it? It's all about how we get rid of the things that we don't need and how we maintain the things that we do need. And then there is the whole mental emotional thing, which is so very important in constitutional prescribing. So when we look at the homeopathic solution, obviously we treat individuals. We treat individual treatment and prescribing the similimum. And I could go through a lot of remedies. I'm not going to do that because, you know, we don't have all day. And also, you are all homeopathic doctors. But please note these remedies, which are the ones I prescribe the most in hyperemesis cases. It's the remedies that I found to cure most cases. I'm sure that you know most of them. If there are some of them that you haven't looked so much into, please do, because they will make a huge difference in your practice. So alongside with the similimum, with the individual treatment, I very often use supporting remedies in these cases because of the etiology that we already know. So the first obvious supporting remedy to think of is the group of the organ remedies. Especially a remedy like chelidonium, low potency for organ support, is very much used in cases of hyperemesis. Actually, all of the liver support remedies are very good for these cases. Bowel nosodes, obviously. Tissue salts. I often use tissue salts when I treat pregnant women because they are in a state, obviously, where they are building a person. They need the building blocks. And these women, they just don't have enough, you know? And if we think about the remedy kingdoms, it would be obvious to think of the mineral kingdom in these cases where there is vomiting and sweating, and you know, where we just keep lacking our nutrition, keep lacking our fluids. So tissue salts are very good during pregnancy, and especially pregnancies like these. Sometimes I also include sarcodes. And the best sarcodes I know for these type of cases are the endocrines. I very often use thyroid gland, which is amazing, obviously, for the whole metabolism. I very often use pituitary gland, which is a sarcode that you could say, if we were going to give it like an overall title, I would say difficult pregnancies, difficult childbirth, think pituitary gland. So the lacs and the metrodonals. The metrodonals are the remedies made from the, you know, everything that comes out with the child. So it's the ammoniacs, it's the white vernix that we have on the skin when we are born. It's the placenta, it's the cord. it's everything that comes with the baby. And the lacks, so looking at the lack kingdom, what first comes to mind, there is this theme about low self-esteem in the lacks. There is a theme about family relation, being taken care of, being alone, being protected, which makes the Lack family and the matrodonals amazing choices to look at when we have hyperemesis cases where we find the etiology to be mainly on the mental emotional side, which is just as real as it's being a GDF15 case. So I would definitely advise to look into those. And of course, prescribe in order to fit the case. We are homeopaths. We don't just support with whatever looks good. I have an honorable mention of one of the sarcodes that I use very much. It's the pituitary gland. And we have 3 sarcodes. There is the pituitary gland, the entire. Then we have the interior and the posterior. And all 3 remedies do have a different symptom picture. So please look them up. But they are very, very good remedies to know of in these cases, and in general, difficult pregnancy and childbirth cases. So when we look at the general symptoms of these remedies in relevance to hyperemesis, we see on the mental emotionals that it has difficult concentration. Well, it is difficult to focus on anything when you're laying in bed all day and feeling horrible. So that's one of the things you will note down first of all when you talk to a woman who has hyperemesis. Confusion, of course, indifference, mood swings. You can imagine how poor these women are feeling. Physicals are nausea, vertigo, vomiting, headache, unstable appetite, and hormonal imbalances. So this is a picture-perfect sarcode for these type of cases, really. And some of the complications which we see in hyperemesis cases, which also can be treated or supported by these sarcodes, are bleeding. Any kind of bleeding during pregnancy, during childbirth, postpartum bleeding, any kind of abnormal bleeding. And this is very normal, actually, looking at many of my hyperemesis cases, that there are spotting, there are bleeding, there are symptoms of, early warning abortion symptoms. And I see that they are balanced very well with pituitary gland as a sarcode. Depending on the situation, depending on the vital force, depending on if it's during childbirth or if it's alongside pregnancy, I usually use them in a very low potency, like 3C, 6C. But sometimes I do go higher, 200C and even up to 10M if the situation fits. Hypertension during pregnancy is also related to these sarcodes. Restricted growth, obviously, it is a growth center in our brain, painful and slow labor. And this could also be because the woman is exhausted and has been for the majority of her pregnancy. This will give her a bit of stimulation, a bit of energy. Miscarriage, that's the bleeding again. It could also be a history of miscarriages. In those cases, the pituitary gland as a sarcode would be great to give as an organ support in a low potency daily. And kidney and liver related pregnancy complications. As we already know from the beginning, these are the complications, some of the complications that we see in women with hyperemesis. And that is why this sarcode or sarcodes can also be used. The pituitary gland sarcodes also have supporting effects on the uterus during childbirth, especially where the patient's vital force is challenged, or in cases of uterus or uterine atony. So uterine atony is something we often see where the woman has a history of miscarriage or a history of giving birth too soon. Giving birth too soon actually happens quite often in cases of hyperemesis, which makes this probably my favorite supporting remedy in these cases. And that is all for today from me. All right. So that that is my best tips for managing these cases.
Frankly speaking, it's a very, very good session. You really show the beauty of homeopathy as well as what are the things to be done, what are the things not to be done, and what are the complications it arises due to the so-called modern medicine usage during pregnancy, and particularly in this kind of vomiting. You defined it in a beautiful way. And
Thank
congratulations
you very much.
you taking from Denmark. Even though you studied, you worked as another professional. Then you turned back to homeopathy after your pregnancy and delivery, and that's really bring you a better homeopath. And now the very smile of your face itself is a thing that required to cool the patient to make him back or make her back health in the shortest possible way, because this kind of expression from a doctor itself heal the patient. So even during even during the presentation, you were able to laugh and smile in at situation which really required that kind of a smile. So medicines
And
also.
that's the real thing, isn't it? I mean, a lot of the things we do. Like,
Yes, we have seen that. There's several people coming over the presentation, and we are making this like this grim. They're talking with the grim faces, but instead you just talk a beautiful subject with a beautiful smiling face. That's another beauty of your session, and you also presented the medicine, the so-called medicine, why these medicines are important and how it can be used. I was just looking at your medicinal kit, whether sepia was there, but it was there. So sepia is one of the best remedy in those conditions where we know that the life turning point of a woman itself is a pregnancy time, and at that time sometimes she may be indifferent to many things, and in those conditions sepia works in a beautiful way. Some people fear that sepia can't be given during pregnancy, but it is not so. And if the symptoms indicated in that way, you can definitely go ahead with sepia. I have a wonderful case cured with sepia. And not only that, you are using this, as you told, the pituitarium is one of your favorite remedy. That is just like three medicines: anti-pituitary, post-pituitary, and pituitarium itself. So that also is an addition to our kit of remedies in this. Thank you for such a session, Dr. Manoj. Those who want to speak to the session, Dr. Singh may raise your hand so that we will allow you to speak. And it is up to Dr. Manoj to begin the session.
Thank you, Dr. Dhanesh. As you rightly mentioned, the smiling face, especially those who are the gynecologists, definitely is needed. But unfortunately, that wasn't there. But this time it is there. That's the most important thing. Then you mentioned about this, the differentiating between the hyperemesis gravidae and this morning sickness. That's very important. And we all know that the role of the miasm of the fetus that also often the cause of this morning sickness or hyperemesis gravidae. So medicines like the sulfur, soranum, all these medicines will help definitely. And you mentioned about the stress, the emotional reasons and emotional causes that always creating problems. And definitely homeopathy alone science which can address these problems and give a solace to the patient. The mental symptoms, the emotional stress, and all things. Moreover, it's a safe medicine. It can act transplantationally to direct to the child. Definitely, that's also giving a lot of hope to homeopathy and a lot of hope to the pregnant woman and the future generations. Then again, you mentioned about this growth differentiating factor 15 regarding the latest invention. That's also good, will give a coup. And definitely miles and miles to go to reach the final target. That's the most important thing. It will act on the produce in the liver and act on the brain to make this process so easy. Then again, the physical, mental stress and the medicines, the Ignatia, Natramor, Staphylococcus aureus, Colchicum, hundreds of medicines are in the homeopathy medicine. There is no shortage of medicine. In fact, nice presentation, congratulations, and come again. The platform not only to come again, should also regularly attend our programs. Thank you.
Thank you.
Yes, that's the point. Dr. Manoj has raised the importance of miasms during pregnancy. What are the things that, what kind of mind, what are the things the woman faces during her pregnancy? That also is a very, very important factor. And you have shown that why this is. People used to say, like this, that there is something in my abdomen, so I have to spit it out. That's the reason why they are spitting like that or vomiting like that. That's what you have read. You are also explained the same in a different way. And those.
Let me add one point again. Whether it is safe to give medicine during pregnancy is the most vexing question in the medical science. But homeopathy is a long science. We can give any medicine.
Yeah,
And
exactly.
definitely should be given. It should be given. So because at that time the vital force in an activated, much active, excited state, so that even the minutest symptoms will manifest at that stage. So based upon that symptoms, definitely the lady as well as the child can be cured. That's the most important thing.
We have seen different situations where women were asked to make abortion because the child is having this kind of thing inside. So there may be brain damage, heart damage, like that. So they are asking, but homeopathic medicines can clear those things which were there, and definitely that will bring a good baby, all in all. That we have seen several times with our. Have you ever experienced such a situation, Dr. Sting, right?
You mean of a child being not well
Yeah.
and then treated with
Sometime,
homeopathy, it
yeah.
will.
No. At the time of pregnancy, some third month or fourth month, when they do this MRI or scanning, then they find that there is some problem with the head, brain, some the problem with the heart. So this child is not is going to born with some congenital problems like that. So you have to abort this case. this kind of advices were given by the so-called specialists. So when they come back to homeopathy, we are able to treat them and we are able to bring them a beautiful child without any abnormalities. What's your opinion on that? Have you ever seen such a case?
Not very often, but I have had cases where there has been some kind of, bad message given after one of these ultrasounds. And then we have treated homeopathically. And then after childbirth, the allopaths usually say that, oh, maybe it was a wrong information they gave.
Exactly. That's what they used to do. Oh, there was nothing wrong with the child. Even without your medication, the child might have survived like that. But frankly,
Yeah, it was a fake positive.
uh, a lot of doctors really surprised us because they agreed that, oh, we never thought that this child would survive with your medicine. But the patients believe their confidence in homeopathy as well as our confidence in our medicine. That is the result of this thing. That this is how we can prove the world that homeopathy is the latest and the purified science. That's why there is no need of any further change in the in our system. Dr. Hahnemann, what was Dr. Hahnemann written was as perfect as ever, and only additions can be added. That's no need of eliminating anything from our materia medica or any of our theory. But everything is as perfect. That's the beauty of our master, Dr. Samuel Hahnemann. Now I invite Dr. Ram Parisa sir to say a few words. Please unmute.
Thank you, Dr. Dhaneji. Namaskar, Dr. Manojji, and congratulations, Dr. STINE Rugge, madam. Very nice presentation, excellent session, and dynamic lectures. A personality of dynamic, your Rugge. So very, very thanks. And during pregnancy, homeopathic medicine, first to third trimester, take the homeopathic medicine, easily delivery. And it easily delivery. There are two sons delivery, my delivery home, only homeopathic medicine. So homeopathic medicine is the gently and no effect or miasmatic, yeah, vaccination effect. It is cure, yani baby is the curative baby, gently baby. So very, very thanks. During medicine, morning sickness, during pregnancy, sepia, cochlear, and easily delivery, colophyllum is a very good remedy. Colophyllum is a very good remedy. So very, very thanks, Doctor. Thank you, madam.
Thank you.
You're very welcome.
Thank you, Dr. Ram Parisa. And it is the time to wind up the session. I invite Dr. Bob Lim to say what are thanks to the session. Dr. Bob Lim from Malaysia. Please unmute. Yes, yes, Dr. Bob. Is there any problem?
Okay, now it's okay.
So it's
Yes, yes.
yes.
I'm sorry. I was just going to sleep. I'm online on my bed when you call me. So I'm sorry. So that was a very, because it's already past midnight in Malaysia. And I would like to say congratulations to Dr. STINE Ruge for a very, very in-depth explanation on the ladies' problem, especially hyperemesis, and all these, whatever the pregnant ladies are facing, and the remedy is given. And I think homeopathy has play a significant role in relieving their symptoms. When I was very new in homeopathy, one of my office colleagues, he had something like the stomach cramp during the during the menses period. She said been suffering for years. I just gave her one pill of tissue remedy from homeopathy, and she got relief instantly. And she say, I've been seeing all the allopathic doctors, and they cannot even cure me with their medicines. So I think that's a wonderful thing about homeopathy. And since we are coming to the Malayalam session, there's another session. I would like to not to drag that time. And on behalf of the IFPH, Bob Lim from Malaysia, would like to say a very big thank you to Dr.STINE Ruge from Denmark for presenting a wonderful webinar tonight. And thank you very much. And we hope to hear from you again soon with more sharing of your successful cases. Thank you very much. And over to you, Dr. Danesh.
Thank you, Dr. Bob Lim, and thank you, Dr. Singh Rao, and those who participate in the session. And tomorrow we will have a session from Dr. Najib Ahmad. Subject will be a holistic approach to body composition and well-being, part 2. Dr. Singh. Thank you, Dr. Singh.
You're very welcome. Thank you for today.
Thank you all. It is over to Dr. Manus to moderate the Malayalam session.
നന്ദി സനേഷ് ഡോക്ടറെ. എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 1516 ദിവസത്തെ മലയാള വിഭാഗത്തിലേക്ക് സ്വാഗതം. ആദ്യം ഒരു നിമിഷത്തെ മൗന പ്രാർത്ഥന.